Hello boys, welcome to PDHPE. This is option 3, sports medicine, and this is STEM 1. In STEM 1, you're going to be looking at the following areas. You will need to learn about direct and indirect injuries. You'll need to learn about soft and hard tissue, and you'll need to learn about overuse injuries. The things that you'll need to be able to do is identify specific examples of each of those classifications. Direct injuries. Direct injuries are caused by an external blow or a force, and they can be caused by a collision with another player or another person. They could also be caused by being struck with an object, for example, a ball or a stick in the sport. Indirect injuries, they can occur in two ways. One is where contact will take place with the ground or another person or an object, but the injury occurs away from the contact site. For example, you might land on your hand and you might dislocate your shoulder. The other type of indirect injury is caused by an internal force. So, for example, the runner might be sprinting down the track and they tear their hamstring. The next way we will classify injuries is in terms of where or the type of tissue that is injured. First one is soft tissue injuries, and these are the most common ones in sport, and they can take a number of different forms. The forms that they can take are skin injuries, we can have muscle injuries, we can have tendon injuries and ligament injuries. For skin, there's abrasions, lacerations and blisters. For muscle injuries, we have tears or strains of the muscle fibres, and also we'll have contusions or bruising. Tendon injuries are tears or strains of the fibres, and we have ligament injuries, which are again tears or sprains, I should say, of the ligament fibres. Hard tissue injuries are to those involving bones of the skeleton. They may also be teeth. They range from fractures and joint dislocations to bruising of the bone, as well as broken teeth. An overuse injury is when repetitive and excessive force is being placed onto a certain part of the body, and that continuous overuse of that body part causes injuries which may be in the form of stress fractures, which are small cracks, or tendonitis, which is an inflammation of the tendon around the joint. Often this can also be accompanied with poor technique for the sports person. Thank you. That's STEM 1. Have a good day.